If you or one of your loved ones are suffering from an eating disorder, what can you do to help? That's what our show today on Good Morning Sri Lanka is all about, and we have Arundhati with us sharing some helpful hints. Again, I have to remind our viewers that medical advice should be sought out, and you should consult a trained medical professional before you follow any kind of treatment or cure for any sort of eating disorder. But of course, you can get a good idea of what types of eating disorders are there, the symptoms, as well as the possible paths that you can take when trying to get over these disorders here on today's show, on this episode of Good Morning Sri Lanka. So we were speaking, Arundhati, about the symptoms and the causes of anorexia, but what can you do to really help someone who is suffering from this eating disorder, where they think that their self-image is so low that they think they're going to gain a lot of weight if they eat anything, so they eat nothing at all? How can you help someone?
It's number one is, as you said, you need to diagnose it. The tips we showed before is really helpful, how to diagnose it, and we need to keep in mind it might not only be a medical condition that we might need to seek psychotherapy and even behavioral patterns, and maybe help people to go into groups of units where they can help each other about this situation. But mostly these patterns which you're talking about as adults at this moment starts at a very young age, right? So if we can diagnose it at that point, when the child becomes very fussy about the food, if the child is losing extensive amount of weight, and address it at the root cause, I think it will be much more easier than waiting to get medical help.
Definitely, and also maybe building an atmosphere at your home where the child can really accept themselves for who they are and be happy with how they look. Yeah, is that very important as well?
It is, and the fact of not always looking at food as calories and where you gain weight, to tell the child that this is fuel you need to have in your body to move on, do things, and of course strike a moderation of food.
Of course, and that's the best way to go about it now. But speaking about another disorder that you brought up in the first segment, bulimia, is something that is very much prevalent, again, like anorexia. So what are the causes and symptoms of bulimia?
The same causes. The cause is the same. As I said, it is psychological and social factors, right? So the effects are generally, what happens is bulimia is you overeat. So you can see someone all of a sudden try to take in a large quantity of food, right? And after a while forcefully trying to throw up or trying to purge because feeling guilty that you ate so much of food, or even go to the extent of using laxatives so that you will digest all the food at once. So yes, so this is again the same thing, but here not like the anorexic patient where you don't want to even look at food. Here you eat food and you find ways of getting rid of the calories.
So I'm going to ask you, because I feel that there is more of a psychological factor involved here than even in anorexia, where in bulimia you eat the food, then it's a guilt trip and you start throwing up again. So I guess here psychological help when you go to a psychiatrist is very important as well, I'm guessing.
Because it all adds up to, I feel, other than the factors we discussed, it all adds up to stress, anxiety and low self-confidence and not believing in yourself.
And all those things together is it's a very bad formula when it comes to eating disorders.
If you don't believe in yourself, you can't do anything.
Definitely. So on that note, we have another video about some of giving you an overview of bulimia and how you can really address it. Let's go check it out.
How to recognize signs and symptoms of bulimia. Bulimia is a serious, sometimes fatal eating disorder in which uncontrolled eating is followed by purging. Learn the signs and symptoms if you are concerned about someone close to you. You will need research materials, an understanding of bulimia nervosa, and a keen eye. Step 1. Spend time with the sufferer. Listen to what they have to say. They may refuse to participate in normal daily activities, seem depressed, or complain about their weight. Step 2. Check the refrigerator at night, then again early morning to see if large amounts of food are missing. Binge eating is often done in secret at night. Step 3. Notice if the person spends a lot of time in the restroom. Most purging, self-induced vomiting, is done in secret. Laxatives, enemas, water, and diet pills are also methods used by bulimics. Step 4. Look for complaints of a sore throat, foul breath, decaying teeth, or sores on the backs of hands. These are signs of repetitive manual purging. Step 5. Seek the advice of a doctor or mental health professional for information on how to approach the individual. Symptoms of bulimia may vary from person to person, but a true diagnosis must come from a licensed professional. Did you know? In ancient Rome, people used to vomit up food in the period of feasting.
Okay, all right. So if you eat too much at a feast, maybe there is a reason for a bit of vomiting here and there. But of course, if it's an eating disorder, then it's a different matter completely. And you feel that pop culture has a lot to do with the prevalence of these eating disorders in our society, where the media is really propagating something that may not be really great for the future generation, for the children as well.
As I said, yes, it has effect, but I think as parents, when the children are young, it's up to us to tell them that what you see on screen is not real life, right? And there is so much more, even for that person who is looking so fabulous, there has a huge price to pay. Right?
Definitely.
So it's more than trying to compare yourself to someone on TV. I feel that it's our duty to raise our children very practically, down to earth, and tell them this is the consequences, right? Because every action has a equal
and
opposite reaction.
Definitely. So that's something to keep in mind, and of course having a healthy, happy home is very important. Food is very important as a fuel, as you mentioned before, but the right food in the right quantity is always the best when it comes to your family and its health. But speaking about one final eating disorder that's very prevalent, and this is binging or overeating. Now do you find that this is maybe the most common that you see in our society today, is it?
I think it's very common with women, right?
Emotional eating, stress eating, I have exams eating, it's a bad day at work eating, it's one day eating.
It's actually trying to find comfort in food, right? But again, the point is you can't find comfort in food for a long period of time.
Yes,
right? Once in a way, it's fine.
When you're
mashed
potatoes here.
No problem. And it's enjoying the food, as I said, in moderation, where you need to think of yourself in a way which you think, okay, I really don't need anything to comfort me. It is your image, it is your self-confidence that you should be strong as a person to handle any situation.
Definitely.
Right? So that is the main aspect we should give a child or anyone, is you don't need to depend on something else to keep you going. Not even food. It only needs a moderation quantity to keep you going.
Because emotional eating becomes a big excuse, actually. People say, I'm under stress, leave me alone, I just want to eat now.
I need my sugar high.
Sugar highs, yes, these are all words that we are quite familiar with.
Excuses.
But they're all excuses, aren't they?
But you should have it once in a way. I mean, we all like to live a little. But as I said, it's really no point trying to overstep that line, because then you're harming yourself into extent unknowingly.
But what is the limit? What is the demarcation between doing it once in a while and the point where it becomes an eating disorder? When should you just say, this is the limit, whoa, I should stop now?
Well, if you are having 3 square meals a day and all of a sudden you think, okay, I don't want this, I'm going on my junk food or my ice cream diet or whatever, because you don't want to eat anything else, right? So you keep doing this for about a week or 2, that is also quite long. You will see the results in those 2 weeks for yourself. You won't have any energy. It will be just empty calories in your body, right? And you won't feel the way you used to feel, even when it comes to any kind of functions in your body when you're eating the wrong food.
So you will definitely see the change in yourself, won't you?
Yes.
Or if you're a parent, you might see the change in your child.
Yeah, because they're empty calories, there's nothing good. Food should be something is you put into your body as a fuel, right? As I said, excuse food or empty calorie food, it's okay just to enjoy your taste buds, but the balance should be why are you eating? That is to keep going right? And give yourself a proper nourishment, and you need to give priority to that and lower priority to the less important things.
Definitely. So on that note, we have another clip ready for you to give you an overview of binge eating or overeating. So let's go see what the clip is all about.